My name is Jimmy. I was in a terrible motorcycle accident recently and ended up in the hospital with severe head trauma. When I woke up, I met this young lady. Her name is Maggie. She's my nurse. Maggie's feisty and she's smart.
I need you to act like a grown-up, okay?
I can tell by the way that she listens to me that she truly cares about me and she's not here to judge. She really listens to what I have to say and she wants me to get better. She's my advocate, but she also motivates me to listen to her advice. Maggie showed me what it was like to be an excellent nurse while I was in the hospital. Maggie shows compassion. She's always asking me how I'm feeling, asking me to rate my pain on a scale from 1 to 10. But she doesn't just ask me for the sake of writing it on a chart. She actually does something about it. She inquires and explores and follows up on it. She sends in specialists to talk with me based on how I feel. Maggie wants me to be comfortable and to get better. But one of the first things she told me is that she was there to help me get better, and that I, the patient, am ultimately responsible for my own health and recovery. She read me this article about a nursing theorist named Dorothea Orem and the self-care deficit nursing theory. At first I thought she was nuts, but then I realized that I was in complete agreement because I was here to get better after my accident, not to be treated like a baby or have my intelligence insulted. Plus, after I leave the hospital, I'll have to do a lot of rehab on my own. I have very limited health insurance because I'm only working part-time right now, and Maggie understands that. She even adjusted our care plan after I mentioned it. Maggie even called the YMCA by my house and hooked me up with a discounted membership so I can keep going with my rehab exercises when I leave here. Maggie makes me laugh when it's appropriate. I think she does this just to make things bearable when some days get long or dark. We joke around and keep things light a lot of the time. It makes me realize that we are both people. It builds trust and confidence. Sometimes she's just goofy.
When are you gonna laugh?
They say that empathy is the act of understanding another's feelings or perceptions, but not necessarily sharing that person's same feelings or point of view. In our case, this is true. Maggie and I may not have much in common. I'm here because I crashed my bike without wearing a helmet. I was driving way too fast. I was stupid. I realize that now. But Maggie doesn't judge. Trust me, the ticket that the troopers gave me took care of that. Maggie just does her job with a smile. She takes care of the incredible pain caused by the crash. She doesn't add to it by nagging me about being too arrogant not to wear a helmet. Maggie is always referencing information on the computer and double-checking medication dosages before she gives them to me. It's not due to a lack of knowledge or confidence. It's because Maggie is thorough and cares about my well-being. I've noticed that other nurses come to Maggie with questions because they know that she always keeps up with the latest information, technology, and medical procedures. She also is working on her master's degree in nursing. She's on top of her game.